Medical tourism combines wellness and healthcare. Colombia Africa is the latest entrant in terms of investment in the healthcare. So I'm joined by Dr. Lindah Thorpe, who is the clinical care coordinator at Colombia Africa, to tell us more on how their entry into the health sector is going to change the dynamics of the health sector. Welcome.
Basically, Colombia Africa is an investment from Colombia Pacific, which is an American-based investment company. They've also set up hospitals in Asia called Colombia Asia, and there's 27 hospitals that spread out over a region between Malaysia, Vietnam, Indonesia, India, and actually China.
Among all the other East African countries, why Kenya? What drew you to invest here?
So basically, yes, exactly. The government has been very conducive to foreign investment, and so Colombia has come in to look at this. Nairobi also is a hub of a lot of things, including medicine, and you get a lot of people coming in for medical care into Nairobi. So it seems like one of the best places to begin with in East Africa.
Why would I seek services at Colombia Africa and not in any other hospital?
The facility here is one which prides itself on hygiene, good waste efficiency, very good cost-effective and quality healthcare, and also it has a seamless IT system which will also help to create a good environment for the patients.
So what services have you been offering since you set up shop in October?
If people are looking for more specialist care, maybe consultations or specialists that they are unable to seek in Kenya because they're not available or because they've already sought it and they want a second opinion, we're able then to use telemedicine, which basically means that they can sit with another doctor in the same room but have a consultation with a specialist who is in another country. So it enables people not to have to travel and so save money on travelling if they don't need to. It also gives people the confidence that if they can stay in Kenya, then they can stay here.
Have you received patients from other parts of the world other than just here in Kenya?
We have had some Ugandan patients, and we've also had people that want maybe a second opinion from, for instance, India, and to see whether they need to go and seek specialist treatment over there.
What impact do you think you, as Colombia Africa, is going to have on the health sector in the long run?
The best way to deal with competition is basically to be the best you can. Patients will always vote with their feet, and as you know, patients can choose any facility that they want to go to. So, you know, we'll aim to be the best that we can, and we'll encourage patients. Obviously, patients, if they come back to us, that in itself says or is a recommendation for us.
Are you aligned to any medical tourism firm like A&K Global Health to create awareness that Colombia Africa is set up here in Nairobi?
We would try and keep patients in Kenya if we can, and if that's what they would like to do, because at the end of the day, the impact on them travelling abroad, you know, there's a cost of flights, there's basically the fact that they're away from home, they're away from their social setup. It's very stressful when you're sick and you're having to seek treatment abroad. So patients will probably do just as well, you know, staying in country if they can. Obviously, that's not everybody's choice, and we don't dictate that.
Are you looking to invest in either Kisumu or Mombasa in the long run?
Colombia Pacific's invested 250 million, and it's obviously with that amount of capital, it's seen as a long-term investment plan. We're not here just for today and gone tomorrow. We're here to basically, you know, invest in healthcare and make a difference really through the technologies that we're trying to bring in, and hopefully bring up, you know, the healthcare facilities that's available to the general public, basically.
In terms of job opportunities, are these jobs local, or are you even having expatriates coming in to work at Colombia Africa?
Colombia is all about the local population. Most of us here are Kenyans or have been brought up in Kenya and are here to stay. So it's not about bringing in the expertise from outside. It's not about importing doctors. Obviously, what we'd like to do is create an environment where, you know, the staff is Kenyan, because that's how you retain people.
When it comes to medical or other healthcare, Kenyans look at cost and availability of specialized treatment. So as Colombia Africa, who is your primary target?
One hopes that the investment would continue depending on the market research. I hope that we'll be providing really good cost-effective clinical care for the general population, mainly targeted at the middle-class population, and I hope that it will increase the confidence within the local market, so people will be seeking help from the doctors here, and the cost of healthcare may come down, or at least be more affordable to people.
In terms of payments, is it just cash only, or have you engaged or partnered with insurance companies?
We do accept some insurance. Other insurance are coming on board, so I think it's we want to target as many people as possible, so of course it's in our interest to get the insurance up and running as well.
Do you see Colombia Africa partnering with NHIF?
I think that's inevitable. In which dynamics, I'm not 100% sure yet, but of course, to be able to reach out to as many people as possible, that's probably something that will have to be looked into and move forward with, basically.
What is triggering the upsurge of lifestyle diseases among our population?
Well, sadly, if you look around us, you can see there's Pizza Inn, there's KFC, and things like that. So those, all the kind of what we'd maybe seen as, as the first world issues, they're all actually with us, and people have more disposable income, and that they can basically afford to have those kind of foods if they want to. People work really hard. They're not as active as they used to be. So of course people are getting more obese. With obesity comes issues like diabetes, high blood pressure, and the cancers are on the rise. People have access to alcohol and smoking.
What do you think about the current doctor strike?
Unfortunately, people end up getting hurt in these environments. And I don't think that any doctor out there, wants people to be hurt at the end of the day.
Having set up here in Kenya, what do you envision for Colombia Africa, maybe in the next 5 years to come?
As a physician anyway, what I would really like to see is that the healthcare improves in this country, and that we're able to offer more cost-effective healthcare, because unfortunately, the services are really expensive for, majority of people, and we are targeting the middle-class population at the end of the day. But, if we can try and, increase the availability of professionals, and also try and decrease the cost of a lot of these services, then I think that will go a long way to enabling people to access healthcare, and in that case that will be able to bring down the fact that diseases are found sometimes too late for them to be treated in a cost-effective manner.
That has been Dr. Lindah Thorpe, who is the Clinical Care Coordinator, Colombia Africa. I'm Regina Manyara-Gitau, and you're watching Business Insight.